All right, Brian. So after some testing, some imaging, we've determined that you have pneumonia. You do have what's called bacterial pneumonia, basically that your pneumonia specifically was caused by a bacteria rather than a virus. Typically, we have two options for treatment for this. We have what's called bacteriostatic medication, which is just antibiotics that prevent the spread of said bacteria causing the issue, and then it allows time for your immune system to react and kill it. Or we have bactericidal, which is where we actually have medications, antibiotics that can come in and directly kill the bacteria themselves. Um, Commonly for bacterial pneumonia, we use azithromycin, which is a macrolide class of bacteria. This just means that they are bacteriostatic. So what it does is it inhibits the use of protein and the creation of protein in our bodies, which then prohibits and kind of stops the growth and the spread of the bacteria causing the issue. And then from there, like I said before, your immune system then comes and attacks and kills the bacteria that's causing the issue. So for the azithromycin, you're going to be taking this once a day with or without food for 5 days straight. It is very, very, very imperative that you finish the full dose. Okay. In about 2 to 3 days, you're probably going to feel real good. You're going to feel like you can just quit taking your meds, go about your business and not have to worry about it. Maybe keep the meds for later if the symptoms come back. I can tell you right now, most likely those symptoms will come back if you don't use it all. Okay. So, like I said, it's bacteriostatic, which means that it's not going to grow and spread. So if you stop taking the antibiotics, what the infection is going to do is that the infection that's left is no longer going to be static. It's going to continue to grow and move and change. And then once it gets spread out enough, it's going to come back and it's going to be stronger. And it's going to be harder to fight off because most likely the infection is going to be resistant to the antibiotics that we've tried. But it will come back and it's probably going to feel also a lot worse. So it's better if you just finish all 5 days of the dose. Again, you can take them with or without food. Whatever you decide, it shouldn't have too many GI complications or anything like that, okay? Until you start to feel better with the antibiotics. If you're having excessive signs and symptoms, you can take other medications like over-the-counter medications that can help. Um, if you feel like, your temperature is really high, you have a fever, then you can take fever reducers. So like aspirin's super common, super easy to get your hands on. If you feel so you already should be taking a lot of fluids, but if you feel like you have a lot of excess phlegm that you just can't really get out, then decongestants are really good. Warm drinks, humid air, those are really good to help loosen up a lot of that stuff and then help you get it out. The warm air or the humid air and the warm drinks are also really good for kind of coating that throat because it probably feels really dry from all the phlegm that is draining and all the drainage that's going down your throat. The one medication that I want you to avoid during this time is anything that's anti-cough. So any sort of anti-cough medication we want to not take right now because the cough is what we call a productive cough. This is where the cough helps to get all the phlegm out and helps to get the bacteria out. And as our immune system kills everything off, the only way for it to go is out our mouth, which is through your cough. So if we're taking anti-cough, we're just keeping all that in, which we don't want to do. Looking for some adverse effects with the azithromycin. It is very common that it causes nausea and diarrhea. So again, important to keep those fluids. As long as it's not continuing past the time of medication or in excess, then you should be okay. But if you have any issues or concerns, you can always give us a call. Less common, but still possible. Just want to make you aware. There are some cardiac events that can happen. A lot of times this is tachycardia, which is just when you feel like your heart's beating really fast. If you have any of those episodes, please let us know. Give us a call. And then any sort of allergic reaction or feeling a little bit too different, give us a call. Let's talk about it. Let's see if we can either, if we need to switch it, if it is an allergic reaction to the azithromycin, or if we can keep going through the end of the treatment with the azithromycin, and maybe this is just a normal side effect that we haven't talked about today. Again, imperative to take it throughout the full 5 days. If you take the full 5 days and you feel like it hasn't done anything or like your symptoms are coming back, let us know and we'll figure out if this is antiviral pneumonia instead, or if maybe just the azithromycin doesn't work for you as well as it does for others. And then we can go from there. Any questions, concerns for me? Perfect.